Namaste. Let us understand the littles area. First of all, why are we even studying this topic? We are studying this because this area is responsible for 90% of the anterior nosebleeds. What is this area? This area is a highly vascular region which is formed by anastomosis of multiple arteries on the nasal septum. Where is this located? It is located at the anterior-inferior side of the septum. The vascular network of arteries that form the Little's area is known as the Kiesselbach's plexus. The arteries involved are the anterior ethmoidal artery, the sphenopalatine artery, the sphenopalatine artery is the most important artery in this plexus. Here we have the lips and behind it we have the palate. Lips also mean labia. So this artery coming here is superior labial branch of the facial artery. And the branch here is greater palatine artery. These four arteries constitute the Kiesselbach's plexus. Now, what are the causes of epistaxis? The first and the most important cause is nose picking, or we can say trauma. The other causes are dry air or dehydration, allergies, viral infections, and hypertension. Hypertension is an important cause in adults. The first aid is Trotter's method. In this method, the patient is seated upright. He has to lean slightly forward, pinch the soft part of his nose, and keep pinching for the next 10 minutes. He has to keep his mouth slightly open so that he can breathe. There is a need of further treatment if the bleeding does not stop in the next 10 to 15 minutes or if the bleed is very profuse. Thank you. That's all about the Little's area.